Hello everyone, my name is Maria Garcia, and today's topic will be on conscientious objection in healthcare, a moral dilemma. Firstly, I want to start off by defining conscientious objection. It is when a healthcare professional, as a result of maintaining moral integrity, refuses to provide or participate in a legal and beneficial service. Moral integrity can encompass personal beliefs, personal values, and religious beliefs. It is most prevalent today due to advancing technology of contemporary medicine. Such example could be enhancement medicine like the growth hormone, and responding to evolving expectations of new technology can conflict with sincerely held religious or personal beliefs of healthcare professionals. The moral dilemma can become challenging in personal obligations and professional obligations. Personal obligations, just like the patient, the healthcare professional is a moral agent with reciprocal rights, where they too have the right to maintain and not compromise their own personal beliefs, values, and if they have religious beliefs, to something that they find consciously immoral. And professional obligations, the healthcare provider still has to ensure the patient's access to care is not impeded if they do have a refusal to a certain service or treatment for the patient. The two sides in moral conflict. One is the supremacy to patient autonomy and the professional duty of the physician are primary reasons to oppose conscientious objection. Those in favor value the morality of the physician as an integral part of the healthcare professional-patient relationship. Where conscious issues arise, one is stress of conscience, which states that a troubled conscience due to an increase of ethically challenging situations to be an unwelcome burden. This can lead to burnout, moral distress, and consequently lead to a lower quality of patient care, which we do not want. And freedom of conscience, which involves direct situations of ethical collision, where a healthcare provider is asked or expected to participate in a specific action he or she deems to be ethically wrong. The decision-making process is both patient and healthcare professionals' contribution of knowledge, where it considers clinician autonomy and role as a professional, even when patient autonomy is primary or considered primary. Patients bring their knowledge of their personal situation, goals, and values, while healthcare professionals bring their expertise on the nature of the problem. The stakeholders, or those affected by the controversy, are the patients, healthcare professionals, and the public health. So why does the controversy matter? Conscientious objection respects healthcare professionals' autonomy and personal integrity. It maintains professional integrity as well and acknowledges a reciprocity of medical decision making, so it doesn't solely depend on patient values, beliefs, background to make a beneficial to come to a beneficial treatment for the patient, but it involves the physician's expertise, background, values, and beliefs of what would be best for the patient as well. And what gives the topic importance? So due to varying ethical guidelines and challenges of conscientious objection, consequences can be expected and can take effect on specific population. Specifically in today's day, women are mostly affected by this by pharmacists or pharmacy companies. This could be with denying emergency contraception due to it being against some pharmacists' religious or moral beliefs. This can lead to higher rates of abortion later on due to not having access to emergency contraception, and it could also lead to social backlash and access to care. Not only to women, but also to other populations such as rural populations or minorities. So the thesis states, healthcare professionals have the right to invoke conscientious objection to maintain their moral integrity only if they fulfill their duty to educate the patient and ensure the patient receives high quality care. The two ethical principles in conflict are autonomy and beneficence. Autonomy, the right to make rational and moral decisions. In the perspective of the healthcare professional, the healthcare provider's autonomy and beliefs preserve moral integrity. but become challenging when they interfere with their duty as a professional in the case that they refuse a controversial or morally undesirable service. In the perspective of the patient, to provide the highest quality of patient care, it's important to respect and honor patient preferences and beliefs. It is also important that patients are fully informed, and conscientious objection is limited to when a patient is in an emergency situation. Beneficence, this principle calls for not just avoiding harm, but also to benefit patients and to promote their welfare. Clinicians' conscientious objection can become an issue of negligence of patient care if the clinician's personal beliefs ultimately interfere with doing what's good for the patient or the patient's preference. Patients have a right to receive accurate information that will service the patient in a timely manner when patient preference for a service is denied. Laws, codes, and duties that are involved in the moral dilemma of conscientious objection. One is the American Medical Association Code 1.1.7 that states preserving physicians to act or to refrain from acting in accordance with conscience in their professional practice is important for preserving the integrity of the medical profession, as well as the integrity of the individual physician, on which patient and the public rely. Secondly, federal statutory healthcare provider conscience protections. These are laws passed by Congress. Two of the main ones that I talk about are the 1970s Church Amendments, which state that they prohibit any entity that receives public funding from discriminating against any healthcare personnel, refusing to perform or assist in the performance of a sterilization or abortion procedure. The Code Snow Amendment states that it prohibits federal, state, and local officials from discriminating against healthcare providers that receive federal financial assistance, that refuse to provide training on abortion care, the abortion procedure itself, or referrals for abortion. State laws, policies allowing providers to refuse will vary within states. Primary examples of these would be abortion, contraception, and sterilization, but it's not just limited to just those three. Refusals by providers will be different and will be handled differently in every state. Institutional policies, there still remains an unclear definition of conscience, and unless indicated, the right to refuse applies to all institutions, whether they're private, religious, or public. Resolutions of the controversy. The healthcare provider should receive established policies from the affiliated institution. The healthcare provider's controversial views should also be made aware when offered a position. And before entering a healthcare professional-patient relationship, the healthcare provider should make clear specific interventions or services that they, in good conscience, cannot provide to the patient. They should uphold standards of informed consent, and they should refer a patient to another physician or institution in a timely manner so that access to care wouldn't be limited to the patient. Solutions for the future. Providing clear ethical guidelines in cases that involve the refusal to treat by a healthcare provider should be implemented, not only by the institution that the healthcare provider works for, but also within state laws. Communication should be clear to not impede providers' beliefs on patients, to maintain trust in the relationship so that patients could therefore maintain long-term trust with other physicians as well, or healthcare professionals. Access to care remains available, and informed consent is provided. Conclusions. So as long as access to care is not compromised, physicians' religious and moral concerns can and should be accommodated. Conscientious objection respects healthcare providers' autonomy, therefore personal integrity and professional integrity is protected. Conscientious objection provides a well-rounded medical decision-making between the healthcare professional and the patient and other parties involved, such as the families and the institution. It also enhances healthcare professional-patient relationship. So it improves trust and better communication.